A very good day, madam. My name is Naayana and my metric number is U4230304. So in today's presentation, I'm going to present my case study that are related to lung cancer. So let's begin. So let's start by defining our clinical case. Our patient is Pui Sui Hu, a 40-year-old male that are born in October 1984. He stands 172 cm and his weight and consequently his body surface area, which is BSA, are not stated in this primary report, which the data will typically collect and calculate and verify with extreme precision for cytotoxic drug dosing. So he has no known allergies and no reported significant medical history other than his primary diagnosis. So, Mr. Pui has been diagnosed with a malignant solid tumor arising from lung tissue, which has been confirmed via true clinical findings and investigation. This disease is particularly serious as it affects both breathing and systemic oxygen exchange, with a profound risk of spread to the other organs, or known as metastasis. So, based on this diagnosis, the treatment team has selected a potent chemotherapy regimen, which is IV gemcitabine combined with IV carboplatin. So, let's explore why. Now we are at the lung cancer overview. So, to understand the rationale of the drug choices, we have to look at the pathology of the lung cancer itself. So, lung cancer defined by the uncontrolled growth of abnormal cells, typically originating in the bronchi, that the lining of the airways. As the cells multiply uncontrollably, they form the tumor that replaces functional lung tissue, that automatically make it one of the leading causes of death worldwide. So, we mainly classify this tumor into two key types based on the cell size and behavior. First, we got the non-small cell lung cancer and small cell lung cancer. This thing is critical as it guides treatment aggressiveness. So, when assessing our patient, we recognize that the primary risk factors are involved. So, when assessing our patient, we recognize the primary risk factors involved. Mr. Pui is relatively young at 40. His risk profile could include extensive history with a smoking or significant exposure to a second-hand smoke or other environmental carcinogens such as asbestos or radon. His symptoms is likely include the common indicators shown here: a persistent cough, coughing up a blood, and unexplained weight loss. And another common symptoms of lung cancer, as I stated here, like chest pain and shortness of breath. All of these which are consequences of localized tumor pressure and systemic inflammation. So by understanding this complete context reinforces why a multi-drug attack is necessary. And now we are moving for the treatment. For lung cancer treatment, we got 6 choices of treatment on this mind map. So first we got surgery, chemotherapy, radiation, immunotherapy, targeted therapy, and combination therapy. So fighting a cancer disease requires a multi-pronged strategy. This treatment mind map illustrates the paradigm of modern oncology. First, we got surgery, chemotherapy, radiation, immunotherapy, targeted therapy, and a combination therapy, which we are doing with Mr. Pui. So, in the case of solid lung tumor, the treatment is rarely a standalone decision. We integrate several modalities, like often aiming for combination therapy, where we use 2 or more agents together. As I mentioned earlier, the one that we are doing with Mr. Pui. So, we also might use a surgery to remove large visible tumor, followed by radiation to destroy a microscopic disease. And as we are seeing a revolution with targeted therapy and immunotherapy, which will attack a specific genetic mutation or leverage the patient's own immune system. However, a conventional chemotherapy remains the foundation of the treatment for advanced cases, which it attacks rapidly dividing cells systemically throughout the body, providing essential control in cases of suspected or confirmed metastatic spread. So next we are going to talk about drug mechanism of chemotherapy drugs. So first we have gemcitabine. So it is classified as an antimetabolite. Antimetabolite will act as a fat building block of DNA. So once it is inserted into the cancer cell's DNA, it will stop the DNA from being copied, so that it will prevent the cell from growing and eventually trigger the cell's death. Second, we use carboplatin, which is a platinum-based agent. So, unlike gemcitabine that trick the cell, carboplatin is an aggressor. It binds directly to the DNA, that forming a cross-link that physically damages the DNA structure. This prevents the cell from dividing. So by combining these two, we are attacking the tumor replication process from two different angles. So now we are moving for the dose calculation. Now look at the math behind the medicine. For our patient, the prescribed dose is 1,600 mg of gemcitabine and 600 mg for carboplatin. For gemcitabine, the concentration available is 100 mg per 1 ml. So to find our volume, 1,600 mg divided by 100 mg per ml equals 16 ml. So given that our vials are only 1,000 mg each, so we will utilize that 2 vials for this preparation. So for carboplatin, our concentration is 150 mg per 15 ml, which is 10 mg per ml. So to reach the 600 mg requirement, 600 mg divided with 10 mg per ml, which is 60 ml. This requires 4 vials of the 150 mg strength. So now we move for labeling. So a proper labeling is our first line of defense against medication error. As you can see on the label, the patient name will clearly indicate the diluent 0.9% sodium chloride and the infusion duration of 30 minutes, as doctor prescribed. So next we move to the IV preparation. First, we will perform a hand hygiene, continue with a dunning procedure wearing a full PPE, glove, gown and mask. All the preparation need to be prepared in a clean room or known as biological safety cabinet or BSC. During the IV preparation, we need to check the prescription and calculate the correct dose, and reconstitute the chemotherapy drug with sterile water if required, and withdraw the calculated dose using aseptic technique and dilute with appropriate diluent, for example, a normal saline, and if only required. And we have to mix it gently and do not shake. And after that, we have to make sure that the label, syringe and IV bag were correct. Finally, any leftover material or equipment is disposed in a specialized cytotoxic container. And finally, we are looking at the adverse effect and the monitoring of these both chemo drugs. Both gemcitabine and carboplatin cause myelosuppression, which is it causes a drop or having a low white blood cells and platelets, which will make the patient vulnerable to infections and bleeding. For carboplatin, it will also cause a bone marrow suppression, especially neutropenia, and also kidney toxicity. So, specifically for gemcitabine, we must perform regular liver function tests, or known as LFT, and for flu-like symptoms. Meanwhile, for carboplatin, our focus shifts to kidney toxicity. As I stated on the slide, we have to monitor the creatine level closely. So the conclusion is, lung cancer is a serious and life-threatening disease that are caused by the uncontrolled growth of abnormal cells in the lung. It is commonly associated with risk factors such as smoking and often present at a late stage. So, the use of combination chemotherapy such as gemcitabine and carboplatin helps to control the cancer growth by targeting the DNA of cell in different ways. So, overall, the proper treatment, early detection, and the proper management are very important to improve patient outcomes and a quality of life. Thank you.